How to use a skin analysis machine in clinical practice. Most skin analysis machines provide a lot of information. The challenge is knowing which findings are actually useful in everyday practice. Always start with the patient, not the machine. Understand their concerns, medical history and treatment goals before performing the analysis. Most consultations focus on these common parameters. Not every parameter is relevant for every patient. Pigmentation, redness, pores, texture, wrinkles, oil, hydration. Assess both visible and underlying pigmentation. This helps establish a baseline and monitor treatment progress over time. Pigmentation assessment, freckles, solar lentigines, melasma, post-inflammatory pigmentation. Areas of increased redness may indicate vascular change, inflammation or sensitive skin. This can influence treatment selection. Texture and pore analysis can be useful when monitoring treatments such as lasers, chemical peels, microneedling and skincare programs. Assess pores and texture, pore size, acne scarring, skin texture. Wrinkle analysis helps document aging changes and provides an objective baseline before treatment. Hydration and oil measurements may help guide skincare recommendations and monitor response to treatment. Any of the most valuable uses of a skin analysis machine is comparing images over time. Consistent photography and documentation are essential. A skin analysis machine is a useful tool. It supports the consultation, but clinical assessment and judgment remain the most important factors. Don't try to analyze every parameter. Focus on the patient's concern. If they present with melasma, concentrate on pigmentation. If they present with acne scars, focus on texture. The machine should support your consultation, not complicate it. That is probably the most practical lesson for beginners.